Hi, I'm Dr. Lawrence Fiedler. Your gastrointestinal tract is literally home to trillions of bacteria. The number of bacteria living in your gastrointestinal tract actually far outnumber your personal number of human cells. Until recently, we were only able to measure a very small minority of these bacteria. Newer molecular analysis techniques have now allowed us to measure the vast majority of these bacteria in further detail. The types of bacteria living in our gut and the balance of bacteria living in our gut has profound implications not just to our gastrointestinal health, but health outside the gastrointestinal tract. We are just beginning to see how certain imbalances in the gut affect not only gastrointestinal disease, such as inflammatory bowel disease, celiac disease, and irritable bowel syndrome, but diseases normally thought to reside outside of the gastrointestinal tract, such as obesity, autoimmune disease, and even certain neuropsychiatric disease. Given all of this new knowledge that we've acquired, we are just beginning to learn how we can try to treat certain imbalances in the gut and influence certain disease states. Prebiotics are foods or substances that actually foster the growth of certain desired bacteria in the gut. Probiotics are packaged cultures of live bacteria that are desirable bacteria in the gut and can certainly influence gut health in a positive way. We are just starting to learn how these prebiotics and probiotics influence certain disease states and are commonly using them in treatment of irritable bowel syndrome, traveler's diarrhea, and chronic abdominal bloating. The most earth-shattering development in our ability to apply our new knowledge of the intestinal biome is clearly how we now treat a disease of the colon called C. diff colitis. C. diff colitis is an infection of the colon, usually resulting from recent intake of antibiotics, which leads to a dramatic gut imbalance. This imbalance allows certain very negative bacteria to affect the colon in an alarming and life-threatening way. In patients who are desperately ill and who have no longer responded to our standard treatments for C. diff colitis, we can now perform a fecal transplant. A fecal transplant involves instilling healthy gut flora from a healthy donor into the colon in order to repopulate the colon. We have been successful in scores of patients repopulating the intestinal flora and have an over 90% success rate in this disease.